Test 1, 2, 3. Airplane mode. There must be a mic on somewhere. Okay, turn this off. You got a code verification? Oh, it's asking, like somebody tried to verify.
Finance Planning and Investment Committee meeting for today. Do we have any citizens? Any question? Okay, and then next on our agenda is approval of the minutes.
Second.
Okay, it's been moved by Roger, second by Trent. Is there any?
Moved by second by Roger.
Roger, okay, whatever, all right. All right, whatever. It was second, that's what I said. All those in, all right, all those in favor of approval of the minutes signify by saying aye. Aye. And those that disapprove by nay. Motion, minutes pass, okay? I have a few comments I want to start off with that I'm sure that all of you are aware that at its last meeting, the Commissioners Court proposed a tax rate for the hospital district for 0.1945. The board is meeting jointly with Finance today so that the CFO can present the updated 2014 budget information that reflects that proposed rate. The board is emphatic to the Tarrant County taxpayers, and we also view this as a win-win for the taxpayers, the lowering of the tax, and individuals who access our service. We will lean into this and continue to keep our focus on our mission and providing quality health care to the communities that we serve. I am hopeful that we will not get distracted by all of the noise that have ensured following last week's court meeting. I hope that we will remain focused on the strategic priorities and support staff in continuing to do good work that the hospital district has always done for the residents of Tarrant County. Okay, and I want to thank the staff for all of your work and board for all of your effort and energy that has been invested in this, okay? Next, we have Sharon to do an update.
Good morning.
Morning.
This is not my budget presentation. I believe in your budget book you have, it's just a one-page consolidated income statement for the 24 revised budget. We don't need your approval today. We have already approved the budget last month. This page has been updated just for the tax rate. The second line down, the ad valorem tax revenue now reflects the court-approved 0.1945. Therefore, our budgeted tax revenue has been modified to $543,360,000. Is everybody finding that on your iPad? That will produce an operating income of $29,451,000, and after investment income and other non-operating revenue and expense, the net income will be $108,945,000 for the year. Are there any questions? Okay. We are modeling that now. As I've stated in some of our other work sessions, this year will not be an enormous impact. We will have to make a few changes going forward. I think what's critical is when you start to look at what the tax rates will be compounding for the next few years, through the opening of the new MOB, through the opening of the new tower. So this year we actually, as you can see on your statement, our tax revenue will fall by about $26 million from 20 3 to 24. If it really just depends on the assumption. If the court does not lower our tax rate going forward, I think our master facility plan will be good. That plan projects out about a 5.5% increase in tax dollars each year. So I think next year we'll have to see how our tax rate gets approved.
But we have no idea about how inflation costs would impact that at the same time, construction costs.
So in the $1.5 billion construction plan that we have now, there has been not only normal construction contingency included, but also inflation.
We included that when we modeled it. Coming out of COVID, we did see those inflationary costs, and so both our contingency and our escalation costs were increased based upon what we thought would happen with inflation moving forward. So PwC worked on that and continues to work on that, but that was considered when we put together the master facility plan.
Sharon, is the only number that changed is the tax revenue?
Yes, sir. All right, thank you very much.
Thank you. Okay. Go into the planning agenda, Trent, and I will ask you, Trent, to go ahead and do the finance too. DT has had car trouble. With all those cars, he gets one with the battery, with the battery go out on him, and so he almost got here, but he had to call a tow truck.
Thank you, Madam Chairman, and if DT happens to make it in, we'll be happy to bring him up to speed, but we're happy to take on the finance agenda too. Before we begin the specifics and the update from Adam, just a couple of comments. I had a chance to visit with Madam Chair as well as Karen yesterday, and to follow up a little bit on what Dorothy said relative to how we go about the planning aspects relative to capital expenditures over the next several years. Let me take everybody back just a few years, back to 2018. I happen to be the only person in the room that was actually a part of the Blue Ribbon Committee from start to finish. At that point in time, Dr. Lowry was on that committee, and Dr. Lowry, as you know, is no longer on the board. DT kind of joined in about halfway through. So the benefit of being on that committee from start to finish was understanding the guidelines that the community articulated relative to JPS's future. And they were guidelines, and there was a great deal of data, a great deal of community surveying, focus groups. A lot of effort went into determining what that plan may look like. Now remember, that was 2018, right? There's been a couple of important things happen since 2018, not least of which was COVID and, about a 30% inflation factor since then. So JPS took the Blue Ribbon Committee and turned that into ultimately what we have today as the Master Facility Plan. That Master Facility Plan came after another Master Facility Plan had been conducted by Boca Powell, and some of us were on the board when that plan was together. So we've seen an iteration and evolution of planning relative to JPS's future that, today we sit on, in progress, several of the Blue Ribbon Committee findings. We already have in the process of building one community health center right now. Community health center is open. Now, it was open when the Blue Ribbon convened. So some could make an argument that, well, that one doesn't count. Even if you did make that argument, Blue Ribbon recommended there be expanded access to health care in Tarrant County. And that was the real focus. It wasn't on, let's go spend a bunch of money on bricks and mortar as soon as we can. It was about recognizing the fact that healthcare access in Tarrant County needed to be expanded. It needed to be improved. So the board, in light of prioritizing, based on Dr. Duncan's recommendation, has taken a position that the medical home model that we have today is very successful, and that we have to be very prudent in how we pursue medical homes in the future. There was no magic to the number 4. 4 was simply the result of the discussions relative to the amount of need that was in Tarrant County. There was no consideration given to partnerships. There was no consideration given to consolidation. There was no consideration given to the actual demand relative to JPS's capacity to deliver those services. Obviously, the voters of Tarrant County, when they went to the polls, put $800 million with the expectation of additional medical homes. No question about that. They also expected a psychiatric hospital, not just a psychiatric emergency center, but a psychiatric hospital. They also expected an ambulatory service center. So as you started to look at all of these elements of the Blue Ribbon Committee recommendations, you have to go back and say, okay, let's look at the evolution of that planning and to see where we are today. There's been a lot of discussion about, well, JPS needs to go build 4 new medical homes right now because that was part of the bond package. Well, so was the psychiatric hospital. So JPS has had to alter our planning relative to our resources to be able to put these programs in place. Dr. Duncan is our leader in that process. Dr. Duncan is the one that comes to us and says, here's what the data says about moving forward on the most important needs. And this board has steadfastly supported and stayed behind Dr. Duncan's recommendations relative to that effort. And I have no doubt that we will continue to do so. But as we look at the accomplishments, even in light of COVID, that they've been significant. They've been very significant. We are building within the MOB, the Ambulatory Surgery Center, right? We are building the Southwest Medical Home currently. Northeast is up and running with psychiatric capacity. There's a lot of things that have happened from that bond program already. But also remember this, that bond program, the Blue Ribbon Committee was not charged with coming up with a budget. They were only charged with defining needs for the future of Tarrant County. When you start applying the Blue Ribbon Committee process to the financial capacity to deliver those services, there is obviously a reckoning that has to take place. And that reckoning takes place right here. We are the ones that have to decide, based on Dr. Duncan's recommendations, what those priorities are moving forward. And we are obligated to live within the resources that we are given to do that. So to go out today and say, we got to start medical home number 3 and 4, construction's got to start today, is not responsible, and it doesn't reflect our charge to make certain that we are delivering the other bond program priorities. Now, there's no question in anybody's mind here that psych hospital is crucial. We know the PED, the PS, the psych emergency detention center is going to be a huge help to us. And that's why it was moved to the front of the program. No question about that. There's a new psych hospital that's going to be built by UT Southwest. The state of Texas is going to build a new psych hospital. Both these are in Dallas, recognize that. But it does help us to the extent that we're not the only game in town. And we do have the ability now to diversify our revenues to where the priorities are most. And so psych hospital was moved to the bottom of the list. As we look at medical homes moving forward, Dr. Duncan has been incredibly intelligent and aggressive about looking for partnerships to meet the goal of Blue Ribbon, which was expanded access. We have done that through our partnership with Cooks. We've done that through construction in progress on Medical Home Southwest. This board nor Dr. Duncan have suggested that the smartest thing for us to do with the resources we have is to take off and start building community home, medical home number 3 and 4. Because there are consolidation opportunities that we have a fiscal responsibility to explore before we go out and start building additional medical homes. Given the resources that we have and the actions of the court, which have reduced the amount of ad valorem revenue that we have moving forward, it's more important than ever that we prioritize and that we apply the resources that we have toward a program that meets the current needs of Tarrant County residents. The 2018 recommendations do not reflect that. They're reflected in the efforts that we have today. And our support of Dr. Duncan moving to accomplish those efforts is critical. But make no mistake, to accuse this board of not doing what the voters said to go build 4 medical homes is irresponsible and inaccurate, completely inaccurate, because it doesn't take into consideration all of the recommendations of Blue Ribbon, and it doesn't take into consideration the element of need that we have today and the priorities that we have. We all know that we have a lesser pot of ad valorem revenue moving forward. That's commissioners' decisions, and as the chairwoman said, that's what we live with, right? But what we don't have to live with is the current thinking that says, and not on behalf of this board, but the current thinking that says JPS is now stalled. JPS can't go anywhere. That is not right. We have a great deal of opportunity in front of us. Remember some of the other Blue Ribbon Committee recommendations where we need to expand our healthcare professionals in Tarrant County. We don't have enough. Well, guess what? We have all talked about the fact that JPS should be a national premier teaching hospital. We shouldn't take second place to anyone in that effort. And that is crucial, not just for JPS and our patients. It's crucial for Tarrant County. It's crucial for this entire region moving forward that we work hard to accomplish that goal. So we can't just take some of the Blue Ribbon Committee recommendations and elevate them to the point that we exclude all the other recommendations that were in that committee, because the assets and resources that JPS has today in no way prohibit or even slow down this board's attention to the details needed to fulfill health care needs in Tarrant County. There are great opportunities ahead of us. Dr. Duncan has led us already into a new public-private partnership, and there are many more out there. And those public-private partnerships are going to help us continue to reduce the overall requirement of ad valorem taxes in the revenue stream to be able to support new revenue streams that come in from these efforts. But we have to make those efforts. We have to be deliberate, we have to be creative, and we got to move forward aggressively, not be distracted by whatever the tax rate is today. We have to live within the resources that we have, and we all understand that. But we need to take Blue Ribbon as a first step, a baby step, if you will, in the ultimate needs of Tarrant County and our health care. And I know this board is committed to that, and I want to push back against any conclusions that say, well, the board's not going out there and building 4 medical homes, because that is a limited and myopic, consideration given where we are, what we have to do, and what we've been through. So with that, Madam Chairwoman, I'd like to call up Mr. Lane to give us our master facility project plan update.
Okay, all right.
Not sure how to follow that.
It won't be hard.
So we do have some really great updates today. This month is a very interesting month. It's essentially a nexus point on several of the projects that we are underway, that are currently underway. So the Psychiatric Emergency Center, that bottom picture that you see up on the screen, we have finished the slab for the connector. This coming month, we will capture the rest of the site to begin construction on the bulk of the Psychiatric Emergency Center. So if you look at the rendering on the top left of that, the large bar where all ambulatory units are in the Psychiatric Emergency Center, we'll begin construction in September. Now, we'll be on the ground for quite a while, drilling piers and doing underground work, but that is set to begin soon. Further, this board has approved IGMP 1 and IGMP 2. The contractor has bought out, meaning they've bid out all the subs, and we have bought out the project through that point, meaning we are well under budget and we have a large contingency in this project. So we're feeling very good financially about this project. So we're moving forward on that one expeditiously. Next is Medical Home Southwest. Again, the bottom picture to the left speaks to what is going on right now. Although we've been living in 115-degree weather for some time, it actually has been beneficial to the project in that we could drill piers uninterrupted. These are the piers that support the foundation. There are over 180 of them on this project. We are 2/3 of the way through that right now. So again, the weather has worked in our favor and we are moving along nicely. Again, we have bid out through work package number 2, which was just approved by the commissioners. And so we are moving along nicely on that project as well. And we are ready to get out of the ground there. Again, that's coming in September. So next, we have the temporary parking. The first lot is complete. It is set to open here in the next coming weeks in September, and the transition will occur. I was just driving the other lots last week, and they are well underway. Curbing is going in, and we have bought out this project as well, and we should start erection on the warehouse, replacement warehouse for storage of our materials, construction materials. And so it is moving along as scheduled as well. So we're very happy about that. In addition to that, and not on a slide because it's not under construction, the parking garage design is complete. We have moved into contract documents, and we are well under budget in that. In fact, 10% under budget, and that is a design build, so the folks that are designing it are pricing out. So our feel for where we are in the pricing is very close. So we're excited about that, and that has full approval of the city all the way through up to drainage right now. So that has moved along nicely. Dorothy sits on the UDC, so she's seen that go through, and we've received numerous compliments on that building. So that is the current update. Again, September is a busy month for us. A lot is happening this next coming month. So.
Okay, questions for Adam?
Go ahead.
No questions? Adam, thank you very much, sir. We appreciate it. There's no other planning committee items for action today, so we'll move into the finance committee report and ask Ms. Clark to come up and present the report. Sharon?
Good morning again. I'm here to present the July financial reports, and before that, I do have just a couple of things, reminders. On your board portal, we do have our investment report from Hilltop for the period ended June 30th. That is out there for your review. We are also, as we start to wrap up the budget, my staff, it's a heavy lift for them. And then we do have the Commissioners Court on September 5th, where Dr. Duncan and I will be presenting the budget that you just saw back to the court. I would expect final approval at their next meeting on September 19th. So, and then as we kind of wrap up budget, just a reminder, our year end is September 30th. So we will be gearing up for our external auditor, BKD, to arrive on site at the end of October, beginning of November, to complete our year end review.
They have a new name now.
They do. I said it wrong. It's Forbes.
Forbes.
Yes, and if you have trouble remembering it, it's kind of a combination of two words, which is forward vision. So that's how I remember it anyway.
Thank you.
So July, if you look at our inpatient statistics, we had a strong month. Our medical surgical admissions looked very close to how they have for the last few months. Just as a reminder, we are starting to, this is the month where we started to decrease the 28 beds that we had during our public health emergency. So you'll start to see perhaps some of those admissions decrease as we try to work with the state to identify new licensed beds.
Is that the total number of beds that were authorized in the emergency?
Yes. It was 2 units that were doubled up. And then after the PHE ended in mid-May, Then a little bit later, the state also recognized the end of the PHE, and the state is who licensed our beds. As you can see, our length of stay was also very constant, and the occupancy rate on the top right is about 86%, which is very full. You know, people often think, well, gosh, you should be up there at 100%, but with bed turnover, the way that most of our rooms do have 2 patients, it's a big challenge to try to fill every bed 100% of the time. I have that 75% occupancy line drawn up there because from just an industry standard, when you get to 75%, you are feeling the pressure of the turnover. Our outpatient statistics on our emergency department, you can see this last quarter, it's really ramped up. That works out to 351 patients seen a day in the emergency department. That makes July the second busiest ever in our emergency department. Urgent care, you can see, is also pretty high and consistent with prior month. Both of our clinics in primary and specialty areas saw a dip similar to last year, but below budget. We did have a lot of providers on PTO and away from the office, so that's just a temporary drop for July. For our surgeries, inpatient surgeries were down a little bit, but outpatient surgeries remained high. And for behavioral health, patient days were just above the budget, but we did have a lot more admissions. So we look like we're consistent with prior year for July and all year, but what's really happened is that patients are being discharged quicker. We're doing better with bed management. And so we are about 14% higher than budget for the year on admission. So that means 14% more patients are going through the same beds. Our emergency department for the psychiatric area remained pretty high for July. And then behavioral health, even though their clinic visits are above their budget, they also had a couple of vacancies in July that are now filled. So we'll see those. The expectation is we'll see those go up in August. On our financial metrics, we continue to see higher self-pay. 2 reasons for that. Number one, our summer months, we do experience a higher self-pay population with the heat. So that is seasonal. And then the other is caused by the Medicaid unwinding that began about 6 weeks ago. So as we work through those and get better numbers, we will bring that back to you. Our FTEs per adjusted patient day in the top right remains favorable and below budget. These are hours paid. You'll see on the next page that we're having some unfavorable dollar variances, price variance, but from a work standpoint, we are favorable with the volume. Our consolidated income statement, if you look at net patient revenue, you do see that as a negative. We're $42 million ahead year to date, and a lot of that underage, again, is driven by the higher self-pay mix that we experienced in July. On our salaries, we are over budget there. Even for the volume, we do have an unfavorable variance of about $2.7 million for the month. Year to date, when we adjust for volumes, we're actually about break even with our flex budget. We did have a mid-year adjustment for certain hard-to-fill positions, and I believe that's driving a large part of that variance against our flex budget. Our operating expenses for the month, combined with salaries, we also had some higher supply numbers. That's held all year with the higher patient volumes, especially in surgery, and the overages that we've seen in our retail pharmacies. So for the month, our operating income is about $20.5 million. Year to date, we're at $131.5 million.
Sharon, can you explain why the supplemental Medicaid funding is running twice as high as budget, and when do you think that will end?
Well, we close our books in September, and we'll pick up our new budget in October. So a couple of things happen with supplemental funding. The first is the HARP program did not get approved by CMS until after this budget was final. So that's going to be about $45 million to the bottom line. And then about 6 weeks ago, we were notified that our DISH payment was going to be more than we had budgeted. It's more than historical. And also our HARP payment was going to be about $32 million higher than budget. Those are formula funding that we get kind of a proportionate piece of the pie. So we don't really know exactly what we're going to get until everyone turns their numbers in, and HHSC tells us towards the end of the year what our number will be. We experience higher than budget, and we can also experience lower than budget. And budget is based on prior year payout, plus anything that we know about the pool size that would change.
So looking at your current numbers, which is around $48 million per month, how far out in the future do you think that number you can comfortably say will last?
So ad valorem is the 48
Oh, I'm sorry,
that I think you're
the
looking
29.
at. But so a big part, I think for the rest of the year, we're going to be at about 14 million over, and then we'll reset in October. The reason that it's so big, again, is we've been accruing HARP. It's been over budget every month since the beginning of the year when we learned about the program. And then just in the last 2 months, we're booking the extra DISH and HARP based on the notification that we got a couple months ago.
And you have the DISH and the supplemental Medicare funding line,
Yes,
Medicaid
yes.
funding line?
That includes DISH, UC, and HARP.
So October, what are you projecting for a monthly, typical monthly revenue?
Well, I left that back, but if you'll give me a minute during the end of the meeting, I'll catch up with you, but it would really just be what's on that line item for the budget divided by 12.
Okay.
We recognize that equally throughout the year. So I believe we budgeted for a slight decrease. So probably won't be too far from the 25 to 28 million that we're recognizing.
So you're saying 211.5 million for the whole year, so just divide that by 12?
Yes, sir.
Starting like October, or do you think it'll vary throughout the year?
Unless I get further information, I will just recognize that budget number. As soon as one of the big questions that we have in the budget is there has been a legislative plan to decrease the DISH pool by about $8 billion. We estimate that that's going to cost JPS $8 million. That has been delayed since before COVID, but it could have been part of the PHE concessions that happened. So I think that's going to be the one big announcement that I'm waiting for. We budgeted for that decrease. If that decrease doesn't happen, then I will change our monthly accrual so that it's correct by the end of the year.
Okay.
Yeah,
So I'm looking at a budgeted supplemental Medicaid funding of about 26 million a month,
correct.
and you've got 29, so that's about a 36 to 40 million dollar drop.
Yes, and if you recall from the budget discussion, there's also a very large impact to the ending of the PHE. We have to do an intergovernmental transfer. We call them IGTs. And we were able to IGT less, push less money up, and get the same amount pushed down for that period of time. So we're going to lose that, and that's going to cost us, I think, 15 or 20 million.
On top of the supplemental Medicaid funding change. So then that's around 55
Correct.
million.
Yeah, and there were some other small changes. If I recall correctly, there's a change of around 40 or 45 million for next year.
Okay, thank you.
Yeah, you bet. Any other questions on the income statement? Okay. That is the end of my prepared remarks for July.
Okay, any questions for Sharon on income statement, consolidated, any of those? If not, then Sharon, let's move into our regular agenda on action items. And
Yes, thank you.
comments on that?
No.
Okay.
So moved.
Have a motion and a second.
Second.
All righty. Motion has been moved and seconded. Any question or discussion? All in favor, say aye.
Aye.
All opposed, same sign. That motion carries. Next, we have, Sharon, we have the approval of an annual contribution to Tarrant County Hospital District Governmental Excess Benefit, the GEBA plan for October 1, 22 to September 30, 2023.
So this is a two-part request. We have, annually, we make our contribution for the participants in both the pension and the GEBA plan. I pulled, also on your board portal are 4 really long actuarial reports. So I pull a few numbers out of that every year to go over with you. We contribute 6.25% of the participants' payroll each year. That is recommended by the actuary based on the current earning assumptions that we have in the plan. The actuarial liability amortization period is 2 years. That's very low. It's a good, healthy plan. We do fund it every year. We have almost 5,900 employees that are participating. 3,400 of those are active, meaning that they are still making contributions to the plan and they're still earning. So we could have some retirees making up that difference, or someone who actually vested in the pension plan who has left our organization. The rest of these, the 430 million is kind of the liability that the actuary sees. It's a complex calculation that if everyone lives to their normal expected life, that's the liability that would occur. Currently, we have about $370 million of assets. Those assets are managed by the Texas Hospital Association Retirement Plan. I do sit on their board, and it's a very active board. So our net position is about 86%. A lot of times you will hear reports of poorly funded plans that are below 60%. So ours is at 86. You have to also remember that we will continue to make plan contributions as participants earn future credit. So that's the trick there. And the discount rate used by the actuary is 6.75%. So our requested contribution for '23 is $18.8 million for the pension, an additional $622,000 for the GIBA. And I don't know if we have to take those separate or if we can just make the motion together.
Well, those are on the agenda separately, Daphne. Do we need to take the pension plan approval first? And if I call that out wrong, I apologize a while ago. I know I said on our financial reports, but this is item A for specifically the pension plan. So we need to do an action item on that one first.
Yes, let's go ahead.
Okay, any questions for Sharon on item A?
Yeah, and I have a procedural question. Mr. Chair and Madam Chair, this is a joint meeting of the Finance Committee and the Board. Are these items that are under the Finance Committee, are we voting on them as the Finance Committee or as the whole Board today?
So any action that you take at this joint meeting will be action of the board.
Okay.
And that is what your bylaws allow for.
Then I'd have a question or two.
Yes, sir.
For Sharon. So Sharon, is our consultants or our actuary recommending that we bring the plan up to 100% funding?
That's a great question, and no. There is a much lower number that the Pension Review Board would require a healthy plan to be at. We have been at 100% last year. Last year, we were at 102. And the drop is a function of the change of market value that happened a year ago. So just to add to the complexity, the actuary is actually looking at how the plan performed a year ago in '22. So when all the markets were down, that's a function of the market being down, that 86%. With the market improvement this coming year during FY '23, we would expect that number to improve again for next year.
So this is a snapshot as of September 30th, 2022?
Yes, they actually say it's October 1st.
October 1st.
But yes, it's the beginning of this year.
And is the 6.75%, that's just the discount rate used in determining the
It's a
net present
historical
value
earning
of
rate
the liabilities?
plan. Yes.
Is the requested contribution designed to just fund the new liabilities accrued during the last plan year or the current plan year, or is that also bringing up our deficit to, closer to 100%?
So right now, that requested contribution of $18.9 million is simply 6.25% of the participant's salary over the year. And then the rest of the information that I'm giving you is really just to tell you that this is a healthy plan. The key to a well-funded plan is to always make a contribution. And I think if you hear about other pension plans in the news, it's because they did not do an annual contribution. So those numbers on the slide do vary somewhat, but if you looked at last year to this year comparison, the changes are really driven by what happened in the market. And since then, they've recovered during this current year.
But the contribution is just the current year salary times 6.25%.
Yes.
And then there's 5884 in the main defined benefit plan. How many participants are in the GIBA?
There have been as many as 4. Last year, there were 2 active participants and 1 that had retired. This year, we have 1 active participant and the retired, and the other active has gone back into the pension payout. Again, we can talk about that a little further if we need to, but it's based on between years of service and age. The GIBA accommodates a payout for 1 participant. And as you accumulate years of service and get to a certain age, then we are able to pay out that benefit through the pension versus the GIBA.
And the GIBA is frozen now to new participants?
The benefit, well, okay, so we have a bifurcated benefit for retirement now. If you were employed at 9/30 of 2020, you had the option to join the plan. You also had a modest match in a 403B. Post that date, you have a more market competitive match in the 403B, but the pension has been closed to new entrants at this time. All the entrants that were there continue to earn years of service. And again, if you were to leave JPS and come back, you would not be able to re-enter the plan.
Okay, so there'll never be new participants in the GIBA?
Correct.
I don't
May I
think
suggest
so.
that you're on the HR committee, right?
Yes.
We will be discussing and bringing additional information on that. So if you could wait to that, I think I can get all your questions answered.
Okay, that's great. Thank you.
Okay, all right. All right.
Any other questions for Sharon on item A? Or did we already vote on that?
No.
Okay, so we need a motion to accept the recommendation for the pension plan contribution for October 1st, 2022 to September 2023. A motion from Roger, second from Ralph. Any question or discussion? And all in favor say aye. Aye. All opposed, same sign. That motion carries. So now let's formally take up any additional presentation points, Sharon, for, and I'm not sure why there's not an item B. I think it's the next item after A is C. But item C, is there any additional information you plan to present relative to the GIBA recommendation?
No, sir.
Okay, so are there any additional questions? As Chairwoman DeVos has said, that's going to be taken up during, but do you want to go ahead and take action on this item?
Because it's a requirement. It's past stuff we have to do something. So,
Okay.
yeah, let's
So
take.
any additional questions on that? So then we need a motion on item C.
So moved.
Motion from Ralph. Second from Dorothy. Any question or discussion? All in favor say aye.
Aye.
Same sign, that motion carries. Sharon, that takes us to, I guess, Ms. Farrell. Approval of purchase agreement between Johnson & Johnson Healthcare Systems and Tarrant County Hospital District. Thank you, Sharon.
Good morning. I'm here with two pricing agreements for orthopedic trauma supplies. These two agreements were part of one large RFP for orthopedic trauma supplies, which, as a reminder, I've already presented the other three agreements at the June Finance Committee. This first agreement is with Johnson & Johnson, again, asking for your approval for the pricing agreement. Annual cost of $1.165 million, and it is approved in our operational budget. This is, again, a 3-year term with potential 2 one-year renewal options.
Any questions concerning the Johnson & Johnson Systems agreement? If not, we need a motion.
Move to approve.
Move from Zim.
Second.
Second from Ralph. Any questions or discussion? All in favor say aye. Aye. Same sign, that motion carries also, and that takes us to approval of pricing agreement for Homedica Osteonics Corporation acting through Orthopedic Stryker, Tarrant County Hospital District.
Yes, this is the final agreement with this large RFP. This is Homedica, and I'm asking for your approval for the pricing agreement, again, for specialty orthopedic trauma implants and supplies. Annual cost $2.583 million and is approved in our operational budget. Another 3-year term with potential 2 one-year renewal options.
Any questions? If not, entertain a motion.
Move approve.
Motion from Ralph. Second. Second from Zim. Any question or discussion? All in favor say aye.
Aye.
All opposed, same sign. That motion carries. Thank you, ma'am. Appreciate it. Joy, approval of services agreement between North Heights Linen Service. Morning.
All right. Good morning.
Morning.
So I'm bringing forward for your consideration approval of a services agreement between the hospital district and North Heights Linen Service. As we are constantly assessing our operations, we provide in-house linen and textile services today. Currently, we are actually partially outsourcing that operation as we've looked at aged equipment, staffing challenges, space constraints in order to keep an adequate level of PAR days on hand for functioning within the organization for what we need. And so we went out for RFP to assess and evaluate what opportunities we may have around linen operations. I will tell you, common in the industry, as we look at our colleagues and partners around the Metroplex, linen operations is outsourced. You can imagine that square footage that houses our equipment takes up quite a bit of square footage that could be utilized in other ways. And so during this RFP process, North Heights presented the lowest cost and best service for the organization, and will allow us to, one, avoid an expense of $2.9 million in capital that would be required for us to continue operations in-house with linens, as well as an annual operational cost savings of around $400,000.
Joy, question, can you explain to us what all the services this includes? I'm imagining a hospital, lots of linens.
That's correct.
Is it all patient rooms?
Yes, so we actually today average around 3.5 million pounds of linens, and so that's everything from your hospital beds and baby blankets. That's on an annual, yeah. And so when you think about that's our outpatient clinics for textiles in-house, it's quite a bit of operation. So like linens at your house, towels, the cloths, mops, rags, everything that would be laundered.
So this then contracts that entire service out?
That's correct. So it would provide, we would maintain some FTE associated with moving clean and dirty linens to that dock in order to get them to North Heights, and then, of course, to get them back up to rooms and deployed. But I'm most excited also for having some of that space that we'd be able to gain by moving some of that large machinery. It's currently about 36,000 square feet of real estate that our linen operation requires. And so this will not only help us to have more days on hand, par level of linens for us, but will also afford us to gain back some of that square footage for other things.
So is there a net reduction in staffing as a result of this change?
So within the linen department itself, yes, there's a reduction of FTE. However, I will tell you that we have multiple opportunities of current vacancies in other areas that are very similar, like jobs of transport services, nutrition services, EVS services, that we are very confident that the employees impacted would have opportunity to have employment here with us at JPS.
And this is effective when, Joy?
This would go into effect, if approved, October 1.
All right.
Is this service just for this location or multiple locations?
The network, sir, multiple locations.
So this gets us completely out of the line of business?
Correct.
You never thought we'd have so many questions about dirty laundry. North Heights is in Amarillo. Are we sending this laundry to Amarillo and bringing it back, or are they going to clean this locally?
So it actually goes to their state-of-the-art facility. It's a co-op there. I will tell you, as we went for RFP, we opened this up multiple locations.
Hang on, it's
Yes.
going to Amarillo?
It is, yes, sir.
Okay.
Sorry.
Thank you.
The contract didn't meet the MWBE, but did any of the other bidders meet it, but just their cost was greater, their bid was greater?
Correct, sir.
Did anybody locally bid it?
I'm sorry?
Did anybody bid it locally? Any provider in Tarrant County?
No. And I'll tell you that before we went out for bid, we were assessing current operations locally. Some of the issues with local operations was around scalability to take on our network. So there's some large facilities that sit on the Dallas side, Dallas County side of Grand Prairie that's rather large. As we talked to some of these, they were like, we'd love to have that business. We do not have capacity at this time to scale to that. North Heights Linen actually represents a co-op, and so it's kind of an interesting model. This state-of-the-art facility is in an underserved community, and so this is kind of a public-private partnership there that is occurring, and so we'll actually, although we want to make sure we maintain jobs in the Fort Worth and Tarrant County area, this will be a revitalization for this neighborhood by adding this service.
Joy, just in case there's some sort of a natural disaster that impacts their facility or some power outage, or what's your contingency if for some reason Amarillo is out of service?
Or iced, yes. And I can tell you, Blake, being someone who has been an executive down there on that lower level in linens when we've only had 2-day par on hand, and again, back to one of the reasons we looked at outsourcing, we will maintain a 7-day, so a full weeks of operation of linens on house. And then part of that contractual relationship with North Heights is that they have, much to what we've had to do, is piecemeal locally with some partners in order to make sure that they establish those linens for us during those instances or act of God. And we've encountered those 2 Februaries in a row because I've been here, yes.
Any other questions for Joy?
What's the annual savings?
Around $400,000. And then the avoided expense of the $2.9 million in, we would need to sink cost into this equipment to make this functional.
To keep it currently functional or to?
Keep it, yeah.
So it's broke down?
It's broke down. We have a mechanic out here every other day with parts they're making, I think. So that we're outsourcing about 50% of the operations today.
50%. Other questions for Joy?
I have one. Is this to continue beyond the master facility plan? Or will we?
I would recommend that we continue to outsource it.
And we don't have scheduled improvements relative to this in any of the master facility plan, do we?
Not that I'm aware. I don't know.
I don't think we do.
No,
It's never
we
been
did not.
discussed as a master facility plan.
I think it's an opportunity to gain back square footage that is a commodity and use it for clinical care space.
Joy, just to clarify, they're laundering our linens. We're not
Correct.
buying linens from them. They're using our inventory and laundering. What's the ramp-up time to make sure we have 7 days on hand?
We are
From
currently Tom Fisher in supply chain. We're already ahead of that with that process, yes.
Yeah, thank you.
Pending approval.
Does that mean we have to buy additional linens? Or that just means we have it already in inventory?
We have current inventory, but in order to get up to that 7-day, we will inject some additional, days on hand. But it's the right thing to do so that we're never in a place, to your point about contingency, mitigation, acts of God, like having that week's worth is the right thing to do from an operations to prevent disruptions.
That's right. What's the cost of that we're going to see?
I will have to bring that back to you. I do know that our supply chain, Tom Fisher, who we've had that conversation of what that added expense, even with that added expense of that linens initially, over time, it's still a savings, I know, from that outsourcing. But yes, there is an added expense, and I do not have that in front of me today.
A lot more trucks on the road between Fort Worth and Amarillo.
Every day.
And that's all you needed to know about hospital laundry, right?
Any other questions for Joy on the recommendation for outsourcing linen services? We need a motion. Have a motion from Zim.
Second.
Second from Ralph. Any question or discussion? All in favor say aye.
Aye.
All opposed, same sign. Thank you very much, Joy.
I'd like to make a comment. In my previous life, I worked for General Dynamics, and we built almost everything that went into an airplane, including the rivets. Our CEO came in and said, look, folks, if we're not number one or number two in what we're producing, we need to go find out who is. And I would hope that we are doing the same thing here. We're looking at all of our services and looking to see if somebody can do it cheaper than we can. Good.
We've got a lot more in the pipeline.
Thank you.
Very good. All righty. That's Joy. Thank you. That takes us, Daphne, to approval of contract for legal services between the Criminal District Attorney of Tarrant County, Texas, and Tarrant County Hospital District.
Thank you, Mr. Petty. For those of you who've been on the board, you realize that we've had a long-standing relationship with the DA's office to provide some of the services that the legal department has been taking on since we've started building our in-house legal department in 2020. We get from them support for our med mal litigation, our commercial litigation contracts that generally do not come to the board, which are, a lot of those that you all don't see because they're under a certain dollar limit. and our third-party collections. And so this is just a renewal of that relationship. And what they do is just pass through the costs of the individuals that provide those services to us. So it's been very cost-efficient. And so I'm asking for approval to enter into another 2-year contract with the DA's office for those services. And it does have the language in there to allow us to continue to evaluate where we can take on those services in-house and scale back the services as we move forward through that relationship.
Well, Daphne, what criteria would you use to determine which elements of that service you would continue or potentially expand in-house?
So it's twofold. One, the contract review itself, we do that work in-house today. We just don't have the bandwidth.
Right.
So we would see, both whether through the continued improvement of our processes, whether we can take that on, or if it's more cost-effective for us to hire a resource to do that work. With the med-mal and commercial litigation, they do a really good job with that. And so, I'm not sure that would be something that I would say we would want to go out and hire an attorney dedicated to do that work for us today. And if it expands beyond what they can do, and it's going to be protracted litigation, we typically would hire outside counsel for that anyway. And so, we just continue to assess our ability to take on the work in-house, whether or not we can produce a cheaper resource, or whether through efficiencies we can manage to do that work without them.
So you're satisfied, because we've spent a lot of time over the years looking at this contract from that very perspective. Previous legal counsel wanted to take more in-house as well, and one of the things we looked at was collection rate, cost of collections, and there's always been a very positive margin for JPS based on continuing to use the criminal district attorney's office. So are you satisfied that, particularly in collections, for example, that we're getting the same level of productivity and they're still in the end justifying the means?
Yeah, so in the collections part of that is probably the cheapest resource, because they actually have a paralegal that is primarily responsible for working with our finance team in managing that work. So, that's not probably something that I would want the in-house legal team focused on anyway. And then, so it would be really looking at the attorney resources and whether or not we would take some of that back in-house.
Okay. Any questions for Daphne on this?
What did we spend on outside counsel last year versus what we received from the district attorney's office?
I did not bring that number, but usually I'll give a report out to the board at least annually to show kind of what our trends are, how we're reducing costs, and that'll be coming up. I don't have that number for you today.
And I think this was your point. We get a really efficient value from the criminal district attorney's office. I guess more than anything, just appreciative of those folks and all they do for us.
Yeah.
Yeah, we've always been very careful to resist the urge to bring any of that in-house on the elements that are the easiest to collect at a cheaper hourly rate than we could do it in-house.
Yeah.
So I appreciate Daphne's diligence in looking at that, because this is something that gets attention every single year, and so we appreciate that. Any other questions for Daphne? Okay, then we need a motion for the CDA contract.
So moved.
A motion from Tim. Second from Ralph. Any question or discussion? All in favor say aye.
Aye.
All opposed, same sign, and that motion carries. Thank you very much, Daphne. And we have one report from you on insurance policy renewal, correct?
We do. Let me see if magic. You can go to the next slide, please. So we did present last month in close to the Finance Committee just our estimates on our insurance premiums. We typically do that in close just so that the committee will have an idea of what we're seeing in terms of market trends, and then we bring that back so we can get a formal approval on the amounts that we will spend on insurance for the coming year. This slide just shows some of the market insights relevant to property. I explained last time that our process is to work with our broker, our consultant. We get a lot of information. We look across what the market is doing. We also look at our internal claims and where our risk has been. When we see any kind of upticks in certain lines of coverage, we want to make sure that you have information around what's driving that. You can see in particular for property insurance, some of what's driving the increase is reinsurance costs for the insurers that are actually providing that coverage. There's inflation that's impacting the values, the product availability, and the labor costs. There's been some catastrophic losses across the industry that have caused property insurance premiums to rise somewhat, and then skilled labor shortages, and then also property values. We've gotten some estimates that 75% of businesses are underinsured by 40% or more. We're actually taking a close look at our property and the appraised value of our existing facilities to make sure that we're insured at the right level. And the AFM has asked us a lot of questions about sort of what we're doing to maintain our older facilities. Next slide, please. Some of the key points around some of our other lines of coverage include for our D&O and EPL, there's been nationwide increase in employment-related claims. So that's something that impacts what insurers are willing to do in terms of that line of coverage. Crime, our premium rates have remained relatively flat. Any increases in that line are generally based on operational growth for the facility. Fiduciary liability, our premiums have remained relatively flat in that area as well. Cyber liability, I'm happy to report, that has been something that we've been worried about for quite some time because we saw really a spike over the last couple of years, and we're actually seeing some decreases. And we were told that that would probably level out, and we've now seen some decrease in our premiums. So we are very excited about that.
Is that based on the current provider, or is that based on a rebid of that particular line?
So I think we ended up on, because we carry three levels on that, and I think we ended up with our current for the primary level, and then but we always look to see where we can get the best excess layers. Residential malpractice, that's been remaining pretty stable. We haven't really had any claims in that area. And then we've already talked a little bit about the property. Next slide, please. Our airport premises liability, modest increase just based on some inflationary trends. Law enforcement claims in that area have increased on a national level, and there's been some significant jury verdicts in that area. So we saw a slight premium increase there. Business auto, that's just been kind of a steady increase. The larger impact has been on automobile physical damage due to repair costs. Storage tank liability claims are rare, and we've seen stable pricing in that area. Volunteer accident, that's pretty much the same as well. And then general liability, any increases there are usually attributed to claims that we would have here and increases in our operations and budgeted expenditures. Next slide, please. So this is the upshot of all of that information. As you can see, we have maintained pretty well. We're expecting for all of the coverage lines, a roughly $300,000 increase over last year. The ones in blue are still, we work very hard to have hard quotes by the time we come to this meeting, but what we are able to do, even though we don't have hard quotes on all of it, we're typically able to get some assurance that we will not exceed that amount. So we come here because of the timing of things. We need to get this in front of the Finance Committee and Board so that we can start signing our policies next month before the end of the fiscal year, before our other coverages run out. And so we always ask for approval of that up to amount that's in the bottom right-hand corner there.
Daphne, question.
Sure. Can you go back?
Excess workers' comp. What is the source of primary workers' comp if we have an excess policy?
We are.
Self-insured?
Yes, we're self-insured, and then for the excess layer, we have a pretty high retention, and I do want to show you, so next slide, please. In order to determine whether or not, we are, have opportunity to self-insure on other lines, or whether we could do something different with any of our coverages, we kind of show this this depiction of what we are seeing in terms of our premium outlay versus our actual recoveries on those particular, or on all of our lines. And as you can see, we had sort of two anomalies, but for the most part, we are not seeing a lot of claim activity relevant to the amount of premiums that we pay. And so we'll continue to do this exercise. The board did challenge us last year to make sure that we have looked at and assessed where we can do something different as opposed to just paying ever increasing premiums. And so we continue to do that work, and this is kind of, an overview of what that looks like.
So you're looking constantly at levels of reinsurance relative to claim risk, and those are individually considered when it comes to RFPs and bidding out these lines, right?
Correct. And when we work with our broker, we're also looking at with our consultant versus what, if we see those sharp increases, what our internal risk is based on our claims history, and based on what we actually pay out of pocket. Because in a lot of cases, we see that we're not even busting through our deductible or our retention. So we're actually covering, 100% of those dollars in-house anyway.
So based on your claims history, it would almost beg the consideration of reducing the reinsurance amount relative to claim history, right?
On some of our lines, but then there's also guidance from, brokers, because obviously, from our consultant, because obviously for certain things, such as, our property, we had a pretty devastating incident with the ice storm. Would we have been able to absorb that, or would it have been better to just go ahead and plan to have that risk covered off by insurance? So those are the sorts of analyses that we run through to make sure that we're constantly looking at that.
Who's our consultant, Daphne?
James Charlesworth is the consulting firm.
And we've been with them for a while?
No, we bid that out. He won the bid last year.
Okay, all right.
So fiscal year 21 was your spike year. Was that due to the freeze?
So a couple of things, yes. We had actually a workers' comp claim, because this is all in. We had a workers' comp claim that year that did actually get through our retention a little bit. And then, yes, we did have a large property claim.
But the total claim was 1.5 million, or the total recovery.
Correct.
So what was our freeze damage?
So we had, there was kind of across the campus, and I think the total claim that we actually submitted and were able to get paid was a little over $1 million, so like 1.1. And then some of this, as I mentioned, was for, a workers' comp claim that we had.
Further questions for Daphne?
Can you go back to the slide that showed that premium slide? So your property, looking at a $300,000, that's almost driving everything, and that's pending some engineering studies?
It is. So it's pending the, final appraisal of our facilities. They did also have a question, to our kind of teams around, what we're doing in terms of addressing some of our risks for our aging facilities. And then the other thing is that they did have a question for us in terms of calculating our business interruption costs. because there's opportunity, if we have that too high, that would actually bring the premium down some as well.
Well, I think it's a lot of money, $1.25 million, and our freeze claim was only a little over $1 million, but what you're insuring here is a massive claim that wipes out a fire that destroys the whole building. You know, that would be $20 million. What do you have, and don't say anything, it's, you know, we're not, it's confidential, but what's the total value of the property approximately for the whole plant that you're insuring with this coverage?
Yeah, I think I brought my sheet, and I'm not going to remember off the top of it.
It's all your comment about 40% undervaluation on insurance.
Right. I'm going to see if I have that number with me. I don't. And then, of course, like I said, what we do is, it's not just the property. We have the, you know, the business interruption number in there. So there's, you know, a lot of information that goes into what we're asking for in terms of total amount of coverage, but I can bring that back.
And this includes the 14 medical homes, the clinics, everything.
Everything.
It's not just the
Property,
plant.
yeah, even where we have.
Every asset we insure, basically.
But this seems pretty low to me. Is that just in account of the sovereign immunity that we benefit from in a lot of ways?
Yeah, so you'll see that we don't have any, we are self-insured on our med-mal. And so that, you know, takes a lot of it off of there. And we just have to cover on certain lines. So, yeah.
Other questions for Daphne? Okay, we need a motion.
So move to approve the estimated premium.
Motion from Blake. Second. Second from Zim. Any question, discussion? Not all in favor, say aye. Aye. All opposed, same sign. That motion carries. And do we have an executive session today?
We do not. We do not.
Okay, so we don't have an executive session. I guess that completes our agenda, does it
Yeah,
not?
we can adjourn.
Okay.
I'll entertain a motion for adjournment.
So moved.
All right, so be it. We are adjourned. Okay.
How nice.